All right. Everybody's got their order in, right? Okay, cool. I tried my best to introduce myself to everyone. I promise you're going to get a more formal introduction here shortly. But there are just a couple housekeeping things that I do like to go through. Okay. Number one is I try to take as much information as I can and condense it into as short as I can so that you guys can eat. Okay. So what I ask you to do is if you have questions as we go, you've got paper in front of you, please write those questions down and hold them until the end. Okay. Once they serve the actual, so they're going to bring the salads in. You guys can eat your salads while I'm talking. Once they bring the actual entree in, we will do a question and answer session, I promise. Okay. I'm here. The absolute best needle lady in the world is sitting right there. We're here to answer as much as we can. But I've done enough of these seminars and classes or whatever you want to call them that I'm going to answer 99.9% of the questions just by nature of what I'm going to share with you tonight. So that's coming. Second thing is if you have your phone, if you could just silence that for me, that would be greatly appreciated. Okay, last thing is I have the same issues that everyone else has right now, and that's staffing issues. So tonight it's just me and Mitch, and Kelly's our cheerleader. So at the end of this, when you go to make an appointment, please don't just, there's a way of doing it, and that's this little half sheet that you have right here. If you'll just fill this out and take it to Mitch, who's my videographer / help / stepson. If you'll take this to him, he actually has appointments for the next couple of weeks that if you hand him this with your information, he's going to write your name on a piece of paper, hand you a card, we're done. It takes all of 30 seconds. Is that cool? Okay. All right, that's the housekeeping stuff that I have for you. I start with the disclaimer. That disclaimer is this: in over 2,000 injections, no babies have ever been harmed. For some reason, in 2021, there is still this black cloud of people thinking that regenerative medicine equals aborted babies. That is not true. It never has been true. It's always been illegal here in the States. If you go to Mexico to do stem cell therapy, all bets are off. But what we talk about tonight are the things that God gave us that He put into birthing material from healthy live births that otherwise would have just been discarded. So if one of the questions at the end, if you asked me, does this come from aborted fetal tissue? I'm going to throw something at you because we've already covered that. Am I clear? Just kidding. I'm not going to throw anything. Hey, next thing is this. I took this picture of our office this morning. Hey, I am here today because I caught wind of a company that comes and does seminars at this restaurant, that they actually bring doctors and practitioners in from out of town to come to your home to do injections, and then they leave and they're gone and you have no support. Hey, we are local. Yes, we're in Idaho Falls. I clocked it from the office. We're at about 32 minutes from here to the office. Hey, but we are here. We're going to be here to support you. We are not going away. Okay, you have this information on that sheet in front of you. So, and you'll be given the information again before you leave. Okay? Now I can introduce myself. Sylvia, I need a funner picture of you so you're not looking so serious. I'm just teasing you. Hey. As I said, my name is Brady Wyrick. By profession or by training, I am a chiropractor. Hey, I went to Texas Chiropractic College. I've been in practice for about 15 years. My practice has focused on functional neurology, functional medicine, and now regenerative medicine. I am not the one who does the injections. Hey, that's Sylvia. It just so happens that when I get into something, I dive in head first. And about 5 years ago, I had a phone call from a friend that said, "Hey, have you ever heard of stem cell therapy?" I said, "What's that?" And it intrigued me. So I took off on this wild ride to figure out what it was and how we could apply it. Then one day, I was fishing with Dr. Glenn Shapiro. In fact, the day that I took this picture, I said, "Hey, Glenn, I got an idea." and I need your license for it. And it has taken off from there. So Dr. Shapiro, Glenn and Vicky are both our medical directors. I should probably put a picture of Vicky up here instead of Glenn because she's a lot better looking than he is. But they're our medical directors. Then, of course, I could not do this without Miss Sylvia sitting right here. Sylvia is a nurse practitioner. She is the second nurse practitioner that I've had since we've been doing this. And I regret that I didn't hire her the day that I met her. For some reason, I was being stubborn, and it took me how many months?
About 4.
That was the worst business decision I've ever made, is to wait 4 months to hire her. I hired her because she was a neonatal flight nurse. That means that she was putting an IV in newborn or premature babies while airborne. If she can do that, she can put a needle in about anything. So when it comes to the actual procedure and how we do this, you're going to love her because she makes the process very, very painless. In fact, most of our people don't even feel the needle go in. They walk out with a Band-Aid and they say, oh, that was it? That's because of her skill set. So that's our team. We have some other support members that you'll meet along the way, but those are the main ones. So what do you guys think? Should I get a picture of her having fun, or should I make these ones more professional?
Yeah, I'll try to get her out fishing and catch her with the fish too.
That sounds like a great idea. Here's another fish picture.
Only it won't be as professional as the picture that you would take, because you're the more professional.
That's all of that is false. If you think this guy looks like me, there's a reason. He's my dad. He is the main reason why I got into regenerative medicine. He was the first patient that we injected about 4 years ago. At the time of his injection, he was scheduled to have both of his knees replaced. To make a long story short, that surgery was canceled and he has never had his knees replaced. And he still rides his bike like a madman during the warmer months. He stays very active. His knees are not pain-free. I want to be clear about that. But they're functional and a lot less pain than what he had before. He is old. I'm just kidding. 76. So he was 72 when we did the injection. Do you guys see the common theme here? So he was 76. So just like a lot of you, here's how the process looks. You go to the doctor when your joints start to hurt. And I didn't ask this. How many people are here for your knees? Hips, backs, spines, bodies, free dinner. It's okay. We still love you. These joints, most of those joints except for the spine, are these big synovial joints, which basically means they're covered by a fluid-filled sac. And they're a lot easier to get needles into and to get material to stay in there because of that sac. The spine, yes, we do a lot of spine injections. We don't go right into the spine. Sylvia goes into the muscles above the spinal levels that are effective. And our success rate with spines, not quite as high as it is with those other big joints, but it's still crazy good. Can I say it that way? So normally what would happen is you start to hurt, so you go to the doctor. What does the doctor do? Take an x-ray. The good ones take an x-ray. And then they send you out, or some of them will tell you to live with it. Some people might go to the over-the-counter to the medications like ibuprofen, Tylenol, etc. Or some people they'll prescribe a painkiller. When this happens, that is typically a lifelong thing. They're masking the problem. They're getting you out of pain. But if you stop taking them, what happens? The pain comes back to the way it was. There are doctors who will prescribe therapy that is great. And then there's others that'll just go straight to surgery. The way I put it in the office when we meet is you start taking those medications. What happens when they stop working? You go to the next thing. which is typically a steroid injection. When the steroid injections stop working, people get told, literally, when you can't sleep or you can't walk, then it's time to get a replacement surgery. Now, I want to be clear, am I anti-surgery? Absolutely not. There are times when it is absolutely necessary, there are no other options, and it has helped a lot of people. Now, my sample size, you have to understand, is a little bit skewed because who comes to me? The people who don't want to have surgery. Okay? So I don't see the people that the surgery works for. I know they're out there. I have colleagues and friends that are surgeons. They do a fantastic job for people. I'm just here to tell you there is another option. There's another direction that you can go. Okay? So a steroid injection, why are those effective? Why do they work? You're on the right track. They're very powerful anti-inflammatories. So you put that needle in there, it gets rid of the inflammation, and then pain goes away. Okay? But that pain slowly comes back. So what do? You go back in and get another one. Okay? Now, Sylvia, I'm going to put you on the spot. How many steroid injections should you get in a lifetime?
3.
3 total. Does anybody know why? Hey, those steroids actually break the joint down over time.
You're talking at one at a time, or 3 everywhere? Or
Everywhere.
no, I mean like 2 on your wrist, or I mean, is it?
Just 3 anywhere. Okay? Well, they don't tell you that, do they? Now, no, you're not. You're cooked. No. The difference between what we're talking about and steroids is this. Steroids break the joint down. Regenerative therapies build the joint back up. That's the big difference. Okay, so let's talk about what is regenerative medicine. What is the definition of regenerative medicine? I got this from nature.com. Regenerative medicine is the branch of medicine that develops methods to regrow, repair, or replace damaged or diseased cells, organs, or tissues. The way I like to put it is that God has given us our body's own ability to heal itself, and He's given us the ability to now augment that system regardless of what age you are. That's how I see it. Okay? What are the benefits of regenerative medicine? Okay? Regenerative therapies promote the release and activation of growth factors and cytokines to regenerate new tissue. I'll talk about that here in just a second. Okay? Little or no recovery time. You walk into the office, you walk out with a Band-Aid, and you can pretty much go back to your activities of daily living that day. Okay? There are some, and everyone's different, but there are some limitations to that, but that's most people. Okay? There is no anesthesia. It's a natural healing process. It almost immediately improves the range of motion. Hey, here comes the story that I told you I was going to tell. Just today, we had a lady come over from Twin Falls. She actually came to a seminar that I did in Twin Falls pre-COVID. So she finally got over today. And Sylvia injected one knee today. She's doing her other knee tomorrow. Cute little lady. She's got a little Texas twang in her, but she's wearing about a skirt that's just a little bit past her knees. She gets the injection done. She walks out of the waiting room in front of a couple other patients that were out there. She lifts up her skirt just above her knees and goes, "Look, I can move my knees." just made us all laugh. But that's usually improved range of motion is one of the first things that we see. Another gentleman last week with a shoulder, we did the injections, like he almost immediately just shot his shoulder into the air. It was really cool. Improved pain relief and decreased inflammation, and it is a long-term solution versus just a few months. Remember what I said about the question? No, I'm just kidding. Everybody's different. Research suggests all the way out to 15 years. So, now, if you write down anything on your paper tonight, write these 2 words down. Okay? Well, technically 3 words. The first word is growth factor. Growth factor. I am hungry. The second word is cytokine. It's right here. It's Cytokines. Cytokines. I have to look because I don't know how to spell it either. Hey. These are naturally occurring substances that happen in your body. They are either proteins or they are hormones, and there's several different types of these growth factors and cytokines. But at the end of the day, guess what they do? They signal your body to repair itself. So when it comes to regenerative medicine, guess what the key is? Signaling these growth factors and cytokines to get your body going in the right direction. Okay, so when you experience that pain relief right in the beginning and then it dropped off and then it started again, that pain relief came from the anti-inflammatory properties. They dropped off and then your growth factors and cytokines kicked in. That's when you started to feel better. Pretty cool, huh? Okay, so typically what will happen is these growth factors and cytokines will actually stimulate a stem cell response. Okay, stem cells are undifferentiated cells that have the ability to signal your body to produce dead and dying cells. Or not produce them, to stop the dead and dying cells and reproduce to take over to replace the dead and dying cells. That's what I was trying to say. Does that make sense to everyone?
Sounds a little better for sure.
Okay. Now, you all have these in your body already. And there are procedures that can be done to harvest this stuff, concentrate it, and put it back into you. But guess what the issue is? The more gray hair you have, the less likely it is that that stuff's going to work for you. Okay, so let's talk about PRP for just a second. This is an actual PRP tube from one of our patients. Okay, so PRP is platelet-rich plasma. And we use this a lot on some of our younger patients, where we take a vial of blood and we stick that vial into a centrifuge that spins it down. All of the red blood cells sink down to the bottom, and it leaves us this lovely yellow stuff right here on top. I'll buy you dinner if you can tell me what's in that yellow stuff. Growth factors and, not placenta, the cytokines. This is coming from you. I hope you don't have placenta. Hey, they're coming from you. So that stuff is full of growth factors and cytokines. You can inject this stuff into the joint and start that process. But again, it's age dependent. So the older you are, the less likely that's going to work for you. Now, I've heard rumors that Medicare will start paying for this stuff starting next year, which makes me scratch my head because that's about 15 years behind where we are right now. Okay? Now, please understand, we still use this in our office, but we use it for more of the younger patients because we're going to get a better response from them. Does this make sense to everyone? Okay. Next up is the amniotic fluid. I think I mentioned to you earlier that it's funny that a lot of the answers to medicine actually have been here the whole time. We've just been looking in the wrong spot. Hey, the amniotic fluid, guess what it's full of? Growth factors and cytokines. But they're actually coming from the youngest source available to us. Hey, remember, healthy moms, healthy babies. They've donated this material to science. Labs have taken it. And we can actually take that and inject it into your joints because it's full of these growth factors and cytokines that are coming from the youngest source available. Using this stuff is getting us a result that we had seen that's parallel to just doing straight stem cell therapy. So is there stem cells in amniotic fluid? You can't tell me that there's not. Right? But I won't sit here and tell you that you're going to get X amount of stem cells per cc, because that's just not what the product is for. It's for those growth factors and cytokines so that your body says, hey, Let's start reproducing and regrowing new cartilage, even in those cases that are bone on bone. Okay, this is where we're at now. This is the stuff that Medicare is covering, which, hallelujah, that's awesome. Okay, we're seeing a ton of people doing remarkably well doing just this. Now, the next thing I want to talk about is the direction that we're headed. Hey, we're past stem cell therapy now, and now we're working with these things called stem cell extracellular vesicles. I dare you to say that 10 times fast. I'm just kidding. I can't even say it once. Hey, the reason why stem cells are effective is because they release these signal molecules. So this is a stem cell here, and it's releasing these little signal molecules. That's what goes to your damaged tissue to tell it to repair and regenerate itself. Okay? I would like to say that this is coming in the future. No, it's here now. We do this now. This is something that Medicare doesn't cover, and we'll talk about that as an option when we chat. Okay? But it's there, and we're seeing some pretty amazing things with that as well. Okay, so those are the options that are out there. So just to recap then, amniotic fluid, for most of the patients that come into our office, this is the direction that we're going to go. Okay, I will give you an option if you want to take it further than that, but this is where the conversation will be centered. Does this make sense to everyone so far? Okay, cool. So let's talk about the frequently asked questions. Number one, what is the cost? Okay, if you have the good old red, white, and blue Medicare card and you have a supplement, your cost is going to be pretty dang close to zero. As in, it will be zero. Now, there's a procedure that we have to go through where we do have to get an approval process. So once we meet and chat, that's what our office's job is to do, is to take your card and submit it, get it approved, and then we get you back, get the injection done. If we can get through that, then there is zero cost. Unless you decide to take it a step further, we'll discuss that. Okay? How long does the procedure take? Depends on if I'm there and what kind of mood I'm in, because if I'm being goofy, it could take a long time. I'm just kidding. Most people are in and out of the office in about 45 minutes. And you literally walk out with a Band-Aid. No need for a driver, no need for anesthesia. It's that fast and it's that simple. Okay. When can I expect results? Remember, this is a very powerful anti-inflammatory, and because of those properties, people will typically see a result the day that we inject them. Now, when I meet with you one-on-one, I will tell you to wait 6 to 8 weeks just to kind of manage your expectations a little bit. Okay? But for most people, we do see a result in that time frame. Now, if we haven't seen a result in that 6 to 8 week time period, we can have a conversation but in a follow-up where we can actually do a second injection. About half of the people do a second injection, but it is possible to do that. Okay? How long do the results last? This is a very, very individual thing. Yes, there's research that is suggesting anywhere from 5 to 15 years. But again, I'm not going to tell you that because everyone just responds differently. Fact is, we don't really know. But if we have to do an injection every couple of years and you don't have to have surgery, is that worth it? Yeah. Absolutely it is. Okay? What if I'm bone on bone? How many times have we heard that, Sylvia? Look, it doesn't matter. Hey, there's still, even if it's just a single cell layer thick, there's still cartilage in there. Your body still wants to produce that cushion. We're just giving it what it needs to start the process over again. But here's the thing, okay? Surgery is always an option. But if you choose to go and get a replacement first, you can't come back to us and expect something different to happen. Okay? You can't undo that. But you can go this direction, get this done, and if it doesn't work, then go get the replacement therapy. That's just, I've never had to have a joint replaced, so I can't have empathy, but that's just kind of the way I see from what I've seen clinically. Right? Is it safe? Absolutely. We had a patient in today that was very, very concerned because she is on chemotherapy, so her immune system is very suppressed. And I flat out told her, I said, look, this product that we're going to use from you, even though it's coming from a different source, this product is immune privileged, meaning your immune system is going to see it, it's going to recognize it, and rather than mounting an attack against it, it's actually going to help move that product to where it's needed. So is it safe? Yes. We always have the conversation about the risk of an injection site because we are putting a needle into your skin, but we've never seen, she knows what she's doing. The worst possible thing that can happen is nothing. Side effects, you just asked that very same question. There really are no side effects. Sometimes people's joints feel a little bit full, but that's a good thing. How many injections does it take? Most of our people, it's just one injection. Yes, we are in Idaho Falls. Yes, you're going to have to come to us. But like I said, from this point to our office, it's like 35 minutes. I may have been pushing the speed limit a little. Let's say 40. What does the procedure look like? Here's what will happen. With that half sheet that you've got there, once we get you on the schedule, we're going to have a conversation talking about your history. What's been done? How long has this been an issue? All the standard questions that you're used to. Most of that will be answered with the paperwork that Mitch will give you when you make the appointment. But just fill that out beforehand. You don't have to have that done tonight. But it's just a matter of just sitting down together and saying, okay, what does this look like? Then we go through and talk about what your Medicare coverage looks like. There are some of those Medicare Advantage plans that are a little harder to work with than others, but that's my problem, not yours. But we take all that into account because we do have to get those approved before we can do anything. Once that's all done, then that's when we get you on Sylvia's schedule. Sylvia will come in and she'll basically ask you the same questions that I did, just so we have two people getting the information, make sure I didn't miss anything, make sure we've got everything covered. And then she's the one that actually puts the needle into the knee or shoulder or whatever the joint is. So you walk out of there, like I said, it only takes about 35 to 45 minutes to actually do the injection once we get it. But it does take a couple days to get through the process of approval. Then we have you come back for a follow-up around 6 weeks afterwards, kind of see where you're at. We do have some therapies that we can do as a follow-up to make sure we're doing the right thing, but you'd have to come to Idaho Falls for those. And those aren't required. We don't charge for them. But if we want to make sure you give you the best chance, then please, let's see you a few more times after that. So that brings me to what is next. It's actually a pretty good picture I took this morning. What is next is go ahead and schedule your consultation. The first one, if you're comfortable coming to the office, then come to the office, let's sit down. If you want to just do it over the phone, by all means, let's just do a phone consult. But when you schedule with Mitch, let him know which one you want to do. Then we know to not expect you in the office that I got to call you. I will tell you, if it is over the phone, I do call you from my cell phone. So when that 569 number calls you from Idaho Falls, it's not a telemarketer, it's not a spam call, it's me. Then at that point, that's when we discuss your options. Is this a good fit for you? Is this the right direction, etc. I've talked about the pre-approval process already, and then we schedule the injection and get the injection done. That's it. So, and then we schedule a follow-up, 4 to 6 weeks later. That's all I had for you tonight. I've said everything I wanted to say. Your food should be here shortly.